Your surgeon may recommend endoscopic sinus surgery. The sinus cavities are air-filled spaces that lie within the bones of your face. They are lined by a mucous membrane and are in continuity with the nasal passage. There are 4 pairs of sinuses: the frontal sinus, behind the forehead, the ethmoid sinus, between the eyes, the maxillary sinus, behind the cheekbones, and the sphenoid sinus, right under the base of the skull. Healthy sinuses are filled with air and have a very thin mucous membrane. On the opposite, inflamed sinuses have a very thick membrane and can be filled with fluid, pus, or polyps. Your surgeon can recommend sinus surgery for several reasons. The most common one is chronic rhinosinusitis that is not improving with medical therapy. Other reasons include a growth or mass in your nose, sinuses, or skull base. Chronic sinusitis is an inflammation of the membrane lining your sinus cavities that lasts more than 3 months. This inflammation can be accompanied by polyps or not. Polyps are grape-like little balls of inflamed tissue that can grow from the sinus membrane and fill your sinuses. If you suffer from chronic sinusitis, you may experience facial pain and headaches, nasal obstruction and congestion, yellow or green discharge from your nose, and loss of smell. Endoscopic sinus surgery is the method of choice for most chronic sinusitis that have failed medical management. It is usually performed in the operating room under general anesthesia. After you are put to sleep, your surgeon will use a small scope and camera to visualize your sinuses and operate through the nose. Therefore, endoscopic sinus surgery is done without having any visible incisions or scar. The main goal of this surgery is to open the natural draining passages of your sinuses and safely remove as many polyps or inflammatory tissue as possible. Depending on your symptoms and imaging results, your surgeon may choose to enlarge the passages from your maxillary sinuses, your ethmoid sinuses, frontal sinuses, and/or sphenoid sinuses,